Hello, everyone. My name is Kemi Orogwemi, and I am one of the ambulatory educators in the Mark Wallace Tower. Today, along with my colleagues, we'll be talking to you guys about emergency response in the ambulatory setting.
Hello, everyone. My name is Leslie Williams.
Hey everyone, my name is Leah Moten. Looking forward to presenting for you guys.
All right, so to get started today, we're going to talk about who do you call in an emergency. There are actually two different numbers that you'll dial depending on where you're located. For those of us that are located in the hospital building, you will dial star 9999. This will activate the emergency response team for the hospital using a TCH phone line. This can also activate any medical emergency, code pink, Dr. Pyro, or de-escalation. For those of us that are off-site and not in the hospital setting, we will dial 911, and this will activate your emergency response teams, which will be the EMS and the fire department. So what will the operator ask you? For those of us that will be dialing star 9999, the operators will ask you, what is your campus? And for all of us, we will say it's the medical center. They will ask you, what is your building? And for most of us, we'll say that we're located in the Wallace Tower. We do have some outpatient clinics that are located outside of the Wallace Tower. You will list or state your respective location. What is your floor? You'll let them know what floor you're on at the time of that emergency, room number, description of the location, what is your name, and what is your callback extension. All of that information respective to where you're located. They'll also ask you, what is your emergency? You will let them know that it's either a code team or a medical emergency, specifically for these two emergencies that we're talking about today. And then, is the person awake and alert? And is the person breathing? These two questions will determine the team that you will receive, and we will talk more about those two teams in the next slide. We want to remember to simply answer the question as asked. You want to focus on information that's needed to get the help that you need, and you want to listen to the summary so that you can confirm that this information is correct. We ask that you be the last one to hang up the phone so that if they have additional questions or need to clarify anything, you're available for that. So what emergency teams respond to the Mark Wallace Tower? There are two teams that you'll get based on the questions that you answer at the end. The first team we have is the IMT, or the Incident Management Team, and then we also have the EC Code team that comes from the Emergency Department. Who chooses which team you responds to you? This is dependent on the last two questions that we talked about earlier. So is the patient awake and alert? And is the patient breathing? If you answer yes, that the patient is awake and alert, you will automatically get the IMT team, or incident management team, based on the operator's algorithm. If you answer no, that the patient is not awake and alert and the patient is not breathing, you will automatically get the EC code team based on the operator's algorithm.
Okay, so now we're going to talk about what support does an IMT provide. So if you are dispatched to the Incident Management Team, or the IMT team, that team comes to assess the patient needs and status. They will provide extra nursing support, a house supervisor, and a respiratory therapist. When an incident management team arrives, they can escalate the original call to an EC code if needed. If the transport is stable, meaning the patient is stable, then they can then transport the patient with just the individuals that we noted before, which would be the extra nurse, the house supervisor, and the respiratory therapist. So what support does an EC code provide? First, we just want to make sure that we understand that an EC code team is the highest level of support. That includes the EC respiratory therapist, EC nurses, physician, security, house supervisor, and other care providers. The EC code team will come with additional equipment and medications. The EC code team will independently manage the transport, even for the stable or unstable patient. The EC code team arrives with a stretcher and all of their materials to transport the patient by themselves. So what type of emergencies do we commonly see in the Mark Wallace Tower? Commonly, we see syncope incidents, which could either be labeled as an IMT or an EC code, depending on how stable the patient is. Likewise, we get incidents of respiratory distress, seizure activity, anaphylaxis, dehydration, and sepsis. These types of emergencies will be dependent upon the location. So we do typically see some of these incidences outside of our clinical areas, but more commonly, some of these incidents like anaphylaxis may occur in clinics such as the infusion clinic or the allergy and immunology clinic.
So what is your role when it comes to emergency response? The next thing that we are going to look at is going to be our roles in an emergency response. So we're going to break down each section or each responsibility by role. So the first thing we're going to talk about is our ancillary or our ASR group. So though that group can call star 9999 or 911 to get help, get an MD or an RN or an APP to come to where the patient is, stand at the elevator to the clinic entrance to direct the team to where the patient's located. They can print out labels and have an ABS, updating patients and families in the clinic on the situation, the situational delay. That's really important because we know if we have a critical patient in our clinic, sometimes there can be an extensive delay with seeing other patients. So if you're in an ancillary or ASR role, that's a really helpful thing to do, is to be able to update the other families in clinic and to let them know that we do have a little bit of a delay because we do have a critical patient in clinic, but we'll be with them just as quickly as we can. And so those are just some of the things that you can do if you are within that role. The next role that we're going to talk about is our medical technician or medical assistant or technicians. So if you're within one of these roles, you can get our Dynamap to take vital signs, get our code card or emergency response card and bring it to the patient's room or wherever the patient's located, pull supplies from the crash cart for the nurse or the physician, start rescue breathing. That is a BLS skill, and medical assistants and technicians are BLS certified. So that is within your scope of practice if you are within that role. Attend to the patient or the caregiver and support them. A patient in distress, family members, it can be really upsetting or frustrating for them to witness something like that. And so attending to them is really helpful. Documenting, that's also helpful to do in this role. And then any other role that is listed for the ancillary or the ASR role, you can do those as well. The next role that we're going to talk about is the nurse role. So the nurses can assign any roles to any of the other staff members if that's not already been done. The nurse will assess the patient. They can start an oxygen source if needed. We can do patient interventions if you're a nurse, so an IV. With the fluids or any medications, just be mindful that we do need a physician's order to be able to give any IV fluids or any medications or do any radiography. And so just keep that in mind if we're ever in an emergency. We do need a verbal order from a physician to be able to move forward with that. We need to obtain a history from the parent or the caregiver, provide a report to the emergency team. And with that, it's typically provider speaking to provider and clinic nurse speaking to emergency team nurse. That's typically how the report is given. And then, of course, any role that's been previously listed already, we can do. And then the role of the MD or the APP in an emergency response. So serve as the designated team lead, assign team roles if that's not already been done, medical management of the patient, and then providing report to the arriving EC physician. So some important to-dos after an emergency response. So entering a note with event details in Epic, patients only, of course. So if you have a patient that had an event, and making sure that we open a progress note and enter what has happened for that patient into their EMR. And entering a safety scoop, we want to make sure that we're doing this for any patients, visitors, or employees. Anybody that has any type of emergency response event, we should be doing that for anybody. We want to notify our clinic leader. And then, of course, we can debrief with your team. And so oftentimes, us as educators will respond to the events, the emergency response events in Wallace Tower. And so we take that opportunity to debrief with the teams. And this is where we talk about things such as what went well. What are things that went well? You know, did communication go well? Did you have all the supplies you needed? Or what are some things that we can improve on? What are some areas of opportunity? You know, maybe we were missing this critical piece of equipment, or we were missing this instrument or these supplies, or maybe our communication could have been a little bit better. And it's within that debrief that we, you know, find things that we can, you know, be really, really proud of because we work really well together as teams, and we can find areas of opportunity that, you know, like I said, supplies or equipment or communication that we can work on. And so that debrief gives us an opportunity to do that. And number one thing that we want to communicate to you guys, your feedback matters so much. So within these debriefs, you're given the opportunity to provide your feedback from emergency response regarding what went well, what needs improvements, any suggestions. Via the post-emergency debriefing. Like I said, this is completed with your educator or your leader, and this drives our quality improvement in ambulatory. This is how we get better. This is how we provide safe, quality patient care, and this is how we do our best. And it is really incredibly valuable. So all that to say, that is our emergency response presentation. We hope you guys enjoyed our time or your time with us. If you have any questions or concerns, please don't hesitate to shoot us an email or give us a call. We're always happy to help you as we can. Thanks so much and have a great day.
Bye. Thank you.